Want to know how to regrow cartilage? We sure do. Welcome to Health Protocol. Today, we're tackling the big question: how can I grow new cartilage? It's a topic that's all over the internet. What you might find is that some supplements or foods can help reduce some of the symptoms from arthritis, like pain, swelling, or improving motion. That's fine. But sometimes when these symptomatic improvements occur, companies then falsely claim it's because you're growing new cartilage. This is simply not true. Even with things we inject that successfully treat people's arthritis symptoms, they are not growing new cartilage, guaranteed. First off, why would you even want to grow new cartilage? Probably because you're dealing with arthritis, or you've suffered an injury that damaged the cartilage in your joints, like your knee, hip, shoulder, or elbow. This can lead to pain, swelling, and reduced function, making you wish for a healthier joint. A quick Google search will bombard you with hundreds of ways to supposedly regenerate cartilage, some involving substances I can barely pronounce, let alone spell. Let's talk about that. What is cartilage? Cartilage is that smooth, shiny, soft tissue found at the ends of bones, where they meet to form a joint. Think of the end of your thigh bone, femur, and the top of your shin bone, tibia, in your knee. They're covered in cartilage, so they can glide over each other smoothly. When that cartilage wears away, that's what we call arthritis. Proven surgical methods for cartilage repair. From a surgical perspective, there are a few proven ways we can try to repair damaged cartilage. These three techniques are quite similar: microfracture drilling abrasion, arthroplasty. The core idea behind these procedures is that if you have an area of abnormal or completely absent cartilage, we deliberately disrupt that small section to encourage blood flow from the bone underneath. The goal is for your body to then create new, almost perfect articular cartilage. We basically rough up the bone beneath the cartilage, causing some bleeding. But here's the catch: what grows back is called fibrocartilage. Fibrocartilage? That doesn't sound like articular cartilage to me. You're right. Articular cartilage is what we call hyaline cartilage. It's the really smooth, resilient kind. Fibrocartilage is different. It's a form of scar tissue. I like to explain it this way. Imagine your healthy cartilage is like the perfectly manicured fairway on a beautiful golf course. If you take a divot out, that's your cartilage loss. What grows back is like weeds. It's green, so it's not dirt, and it provides some cushion, but it's definitely not the same as the original grass. Or, think of it like cutting out a piece of your plush carpet, revealing the underpaid. If you then put in a lower-grade, different carpet patch, people will notice. These three techniques are among the less invasive surgical interventions to regenerate cartilage, and they're part of a field called regenerative medicine. We sometimes perform these during arthroscopy if there's a very small, isolated area of bare bone. Your surgeon might have told you, "We performed a microfracture where we penetrated this tiny area, hoping to make it less abnormal." The next level of surgical invasiveness would be something like a MACI, matrix-assisted chondrocyte implantation technique. This is quite complex. We take a small piece of your cartilage, send it to a lab to grow and expand it, and then implant it back into your knee using some sort of matrix. It's very complicated, but it seems to work a majority of the time, again, for very small, focal areas of cartilage damage. Not for someone who needs a full artificial knee because an entire joint surface has eroded. Most of what we're talking about here is for these precise, limited areas of damage. Beyond that, we get into transplantation, autograft. This means taking cartilage from your own body, usually from a less used part of your knee, and transplanting it to a weight-bearing area where there's a lesion. Allograft. This involves using cartilage donated from a deceased individual. It typically works best if it's a fresh transplant, which can be tricky to arrange. These surgical methods aren't truly regenerating cartilage. They're more like trying to repair damage, a bit like a plug or a patch. The reason it's so difficult is that adult cartilage does not have the natural potential to heal or regenerate. Think about a chicken drumstick. That shiny, smooth stuff on the end of the bone, that's cartilage. And yes, that's coming from a vegan, so you can take that to the bank. The truth about regeneration. Some tissues in the body can heal and regenerate. Break a bone, and it will heal. Your liver is incredibly robust at regeneration. Don't try this at home. Your skin, thankfully, the largest organ, can also heal and regenerate. But certain things in the body cannot. The spinal cord is a prime example. Once injured, it's often permanent because it can't heal or regenerate. Cartilage is the same. If you damage the cartilage in a joint, maybe in children it has some healing potential, but in adults, once you've passed puberty and your growth plates have closed, that cartilage cannot heal or regenerate. The surgical techniques we discussed have scientific evidence from clinical studies. They measure success by later examining the joint with a scope or MRI to see if the transplantation or repair was effective. It's an invasive process, and it's essentially a repair or transplantation, not a true regeneration of your original cartilage. Supplements and extraordinary claims. Now, for the important part. The internet is full of claims about supplements that can grow new cartilage, making it sound so easy and exciting. I would just like to take a supplement that grows new cartilage. As Carl Sagan used to say, or popularize, extraordinary claims require extraordinary evidence. This applies to so many areas of health and medicine, especially those on the internet, where extraordinary claims are made constantly, most of them lacking any evidence, let alone extraordinary evidence. We're not here to bash any specific supplement, natural remedy, or pill. Instead, we want to empower you to critically evaluate the marketing tactics behind these products. So, let's go through the list of supplements that have truly good, rigorous scientific evidence to show they can regrow cartilage. Number 1. Silence. That's it. We hope you enjoyed our list of supplements that can regrow cartilage. There are no supplements or foods that have ever been shown in a rigorous clinical study to regrow your cartilage. This is, as of today. If you're watching this in the future, maybe in hologram format while flying your car on Jupiter, perhaps then. But right now, no. Think of it this way. God forbid you have a traumatic amputation of a digit, like a thumb or a finger. We know all the compounds in a finger: cartilage, calcium, various chemicals. You can't just take a pill made of those chemicals and grow your finger back, right? You can have a surgical transplant, but no supplement will regenerate your finger. The same principle applies to cartilage. Anytime you see a claim that something will grow back your cartilage, just ask yourself, will it grow back my finger if it gets cut off? If the answer is no, it won't grow back your cartilage either. That's my test. It's a high bar, but it's accurate. Leave a comment if you've taken something and were told it grew your cartilage. Or, leave a comment if you've taken something that genuinely helped your arthritis symptoms. What about stem cells and PRP? Many of you will have questions about stem cells. Stem cells are pluripotent cells that exist in your body. meaning they have the potential to turn into many different types of tissue. Think of them like a blank white t-shirt ready for tie-dye. You can make it red, blue, yellow, or patterned. When we're conceived, we start as just a couple of cells, the ultimate stem cells with the potential to become everything that makes us, us. Scientists are trying to harness these stem cells and encourage them to become cartilage. It's possible to take stem cells in a lab, with incredibly smart people working tirelessly, to convince them to turn into cartilage. Our bodies naturally do this with complex signaling pathways to say, hey, become a liver, or hey, become an arm. But that's what we have to figure out, how to send those precise signals so the cells listen and do what they're told. The current state of the art is that even if we can get stem cells to turn into cartilage in a lab, that cartilage still doesn't have the good mechanical properties of your own natural cartilage. They've grown it, put it in, and it fails. I've been part of research teams doing these experiments, and I can tell you right now, it's not there yet. So, how can you imagine taking some stem cells from one part of your body, or even fat cells, and injecting them into a joint, and suddenly they'll turn into cartilage? The chance of that happening is zero, and that's why it doesn't happen. So, stem cells right now do not help or grow back cartilage in a joint. Some people claim they can reduce symptoms, which is potentially possible, but we need the studies to show it. Show me the evidence. The long-lost cousin of stem cell therapy is PRP, platelet-rich plasma therapy. We've done a couple of videos on this topic. It's where they take a bit of your blood, spin it down, isolate the platelet-rich part, and inject it back into your joint. This will not grow back your cartilage. It may help your symptoms, perhaps for a while. There's some evidence pointing to that. But it will not grow back your cartilage, period. Other popular claims. What about MSM? Have you seen claims for that? I've seen many, but no evidence to support them. Chondroitin, number shark cartilage, number turmeric. It might reduce some of your symptoms again, but it's not going to grow back anything. It will not replace lost, worn-out cartilage. And this isn't anti-big pharma. We just don't want people to be misled by businesses selling products that make claims that simply aren't true. Now, there might be other videos out there from nutraceutical supplement companies that say, oh, Paul and Brad are just saying that because they're surgeons. Of course, they're going to say there are only surgical ways to do it. And you might be thinking that too. Listen, if I had a genie and it granted me one wish, I would wish for the ability to grow back cartilage. Just remember, if I take this pill, will it grow back a finger if it gets cut off? Number. Will it grow back my cartilage? Number now, you know. We thought this was an important topic because people with severe arthritis are often desperate, and we just don't want you to spend your money or place your hope in something that isn't based on facts. Put your hope in the research. Regenerative medicine is a huge and very exciting field. The FDA even has its own arm for regenerative medicine. So, there's a lot of research happening. And maybe someday, when you're watching us in hologram format from your flying car on Jupiter, you'll say, hey, remember when those guys said you couldn't grow cartilage? Who's laughing now? If you like this video, please give it a thumbs up